Let's discuss the Chinese medical theory, the reconstructing TCM. TCM theory presents a number of problems for the scientist. It employs complex concepts like qi and phlegm that have multiple and often somewhat obscure meanings. It reduces anatomy to a set of organs that are in fact functional systems and not somatic structures as we understand them in modern anatomy, and a network of meridians, channels that had been painstakingly mapped out in medical manuals that had never been isolated in human dissections. Its account of human physiology reduces it to simplified models of relationship among organs, meridians, and body fluids. A system of medicine based on anatomical and physiological models so much at variance with modern medical knowledge of human body cannot expect to be taken seriously unless there is evidence that its apparent obvious theoretical base aside. It works as an effective tool of diagnosis and therapy for at least for some illnesses. Based on the history of Chinese medicine in providing healthcare from ancient to modern times, there is a prima facie case of supposing that it provides healing for some ailments. Any experienced doctor would concede that some folk remedies do work and that a few old wives' tales are true. There can be little doubt, for example, that the herb duang, radix et rhizome ray, used for constipation can induce purging, as anyone who takes a large dose would rapidly discover, or that duang herba expiratory helps induce perspiration and alleviate fevers. Its derivative, ephedrine, is now extensively used in rapid medications. But for most Chinese medical treatment, even when these treatments are followed by patient recovery, the question still remains whether the patient would have got better without treatment or whether only a placebo effect was at work. Hence, there is a need to study these treatments through appropriate clinical trials. There is also the possibility that the treatment works for some, but not for most of the ailments for which it makes claims. Bloodletting was practiced in Chinese medicine and also in Europe based on the now defunct Galenic theory of body humors for almost 2,000 years before it fell into disrepute in the late 19th century. Yet, it is used by modern medicine today as a life-saving method of treatment for a very limited number of blood-related illnesses, such as hemochromatosis and polycythemia rubra vera. Bloodletting therapeutic phlebotomy was used to treat hereditary hemochromatosis, in which there is slow excessive iron buildup in the body, causing damage to organs such as the liver, heart, and joints. Regularly reducing the volume of blood in the body is also currently the main treatment for polycythemia rubra vera, in which the blood becomes much too thick, increasing the risk of clots and stroke. Phlebotomy can also help people who are producing too many red cells because their bodies are starved of oxygen owing to a heart or lung problem. Small amount of bloodletting can be still used by some Chinese physicians to temporarily relieve conditions like hypertension, although with the availability of modern drugs, this has now come to be regarded as a primitive and risky infection-prone method of treatment. The challenge then for believers in TCM is to tease out this condition for which they can be demonstrated through a clinical trial to work consistently. TCM is not unlike Hippocratic or Galenic medicine practice in ancient Greece or Rome and medieval Europe, except that the Chinese continued using it to modern times and arguably may well have developed a better system. It is worthy of note that in modern Europe, enough useful knowledge in Galen's work were considered to exist, so these works continued to be studied in medical schools in England in the first half of the 20th century. in part because of some of Galen's method were still valid and useful. Likewise, the century mains concept and simple models may have captured some essential aspect of human physiology in some fuzzy, holistic way such that it works for some ailments. Thank you for your attention.
Let's talk about interviewing, the general questions. Some jobs or occupations will predispose people to particular imbalances. People who work in environments where there is a pronounced or constant climatic influence can be invaded or weakened by these exogenous influences. This could, for example, be a person who works on a trawler or in a cold storage unit. All day long, they will be exposed to dampness and cold. Steel mill workers are constantly exposed to heat, whilst laundry workers and kitchen staff are often affected by dampness and heat. Clerical staff can also be affected by climate. This could, for example, be due to dryness resulting from a poor indoor climate in concrete buildings. Even though dryness is not usually a form of exogenous pathogenic factor that is often seen in Western and Northern Europe, they could also sit in a draft. Repetitive or excessive strain and poor posture can also be an aspect of some people's jobs, and this can damage the muscles and channels and weaken certain organs. Lifting heavy objects weakens kidney yang. Standing for long periods of time also weakens the kidneys, whereas sitting excessively can weaken spleen qi, as well as stagnating liver qi and qi in the intestines. Lung qi is weakened by sitting with the shoulders slumped forwards. One must also listen to the person's voice and observe their eyes whilst they talk about their employment. Do they sound happy or frustrated and sad? How do they talk about their work? Does it sound as if there are conflicts and friction? Does it sound as if their work gives them inspiration and joy? Their work can be a part of their etiology, but it can also be something that contributes positively to their lives. Habitation. The standard of housing used to be a major etiological factor in Northern Europe, and it still is in many other parts of the world. This is because the home is a place we spend a lot of time. To live in an abode that is cold, damp, or drafty would have been a major etiological factor in the past. The standard of living has generally increased over the last 50 years, but the person's housing can still be a relevant factor. Some people still live in damp and cold buildings, while others who live in modern concrete constructions can have the opposite problem. That is, that the indoor air is too dry. Others are affected by there being fungus, for example, dry rot, in the building where they live or work. This fungus will often give the person the same symptoms and signs that are seen in dampness. It is important to find out whether a person's symptoms improve when they are not at home or at work in this building. Inquiring about the person's family situation, whether they are married or have a partner, whether they have children, and whether they have a social network around them can tell us several things. It will give us an idea of how much support they have, but also the way that they talk about these things can give an indication of whether there is heart qi deficiency or liver qi stagnation. If they sound lonely and sad, this can indicate that there is heart qi deficiency, because social contact, love, and joy all help to nourish heart qi. Being stuck in situations where there is frustration, irritation, and dissatisfaction will create liver qi stagnation. It requires respect and tact to ask about these issues, and we must be conscious of our limitations as a therapist. Medical history refers not to the current symptoms that the person has sought treatment for, but the diseases and disorders they have previously suffered from, the surgery they have had, and the medication they have taken throughout their life. The diseases, surgeries, and disorders that they have had will inform you about possible historical and current imbalance patterns. These patterns can also be instrumental in the development of their current patterns of imbalance. A severe febrile illness can have damaged their yin or created phlegm. An operation will usually result in blood stagnation in the form of scar tissue. Medication, especially prolonged or repeated use of the medicine, is often a relevant etiological factor. Antibiotics, for example, may have weakened their spleen yang and created dampness, whilst painkillers may have created stomach fire and damaged their yin. It can also be relevant to ask about hereditary diseases. Some diseases and disorders are inherited in some families. Imbalances and diseases can be passed on in several ways. A person's constitution is dependent on the gene that they have inherited from their parents. This means that weaknesses can be passed on to the children in the same way that diseases are genetically inherited in Western medicine. A fetus is created and nourished for 9 months by its mother's qi, blood, and jing. It is physically and energetically a part of her body. This means that as the foster develops, it may be significantly and fundamentally influenced by her patterns of imbalance. Another factor is that by growing up in the same climatic and psychological environment, as well as eating the same diet for years, a person will often develop some of the same imbalances as their parents and siblings. Finally, a small child resonates energetically with its mother and is not yet completely separated from her qi. This means that her patterns of imbalance can affect the child's qi and thereby produce the same patterns of imbalance. Enquiry should be made about a patient's current medication use, including which medicine they are taking, what they are taking it for, how long they have been taking it, and in what dosages. This should include not only prescription medicine, but also over-the-counter medicines and herbal remedies. It is important to ask about everything a person takes. Amazingly, there are many patients who do not think of their sleeping pill as being medicine, even though it is prescribed by a doctor, nor the painkillers that they take because you can buy them from the supermarket. Nevertheless, these medicines will have a greater or lesser effect on their physiology. They can blur the relevant signs, such as insomnia, for example, but they may well also be part of the etiology of the patient's current imbalances. Herbal medicine and dietary supplements also have a physiological effect on the body, so it is important to ask about the patient's use of these. It is a good idea to familiarize yourself with the Chinese medicine dynamics of the most common medications, both those used in Western medicine and commonly used supplements. It is beyond the scope of our competence to go into detail about the energetic effects of the many and varied medications that people take. Thank you for your attention.
Let's continue with the core principles of Yin and Yang. And today we discuss transformation, change, conservation, storage, and sustainment. Yin corresponds to conservation and storage. This is reflected in the functions of the yin organs, which stores blood, body fluids, and essence, and guard them as precious essences. Yang corresponds to transformation and change. This is reflected in the function of the yang organs, which are constantly filled and emptied, and which constantly transform, transport, and excrete. Those are general guidelines enabling us through the theory of yin and yang to interpret clinical manifestations. All symptoms and signs can be interpreted in the light of the above guidelines because all clinical manifestations arise from a separation of yin and yang. In health, yin and yang are harmoniously blended in a dynamic balance. When yin and yang are so balanced, they cannot be identified as separate entities. Hence, symptoms and signs do not appear. For example, if yin and yang and qi and blood are balanced, the face will have a normal pink, flourishing color and will be neither too pale nor too red, neither too colorless nor too dark, and so on. In other words, nothing can be observed. If yin and yang are out of balance, they become separated. There will be too much of one or the other, and the face will be either too pale if there is an excess of yin, or too red if there is an excess of yang. Yin and yang therefore show themselves when they are out of balance. One can visualize the yin-yang supreme ultimate symbol spinning very fast. In this case, the white and the black will not be visible because they cannot be separated by the eye. Similarly, when yin and yang are balanced and moving harmoniously, they cannot be separated. They are not visible and symptoms and signs will not arise. All symptoms and signs can be interpreted in this way, that is, as a loss of balance of yin and yang. Another example, if yin and yang are balanced, urine will be of a normal pale yellow color and of normal amount. If yin is in excess, it will be very pale, looking almost like water and profuse. If yang is in excess, it will be rather dark and scanty. So to summarize, all symptoms and signs are ultimately due to an imbalance between yin and yang. Keeping in mind the general principles of yin and yang character of symptoms and signs, we can list the main clinical manifestations as follows. Acute disease is ascribed to yang, while if it's a chronic disease, it's yin. If the onset is rapid, it's yang. If the onset is gradual, it's yin. There is rapid pathological changes, it is yang. While if it's a lingering disease, it's yin. If there is heat, it's yang. While if it's cold, it's yin. When there is restlessness and insomnia, it's yang. When there is sleepiness and listlessness, it's yin. Throwing of bedclothes is ascribed to yang, while liking to be covered is yin. A person who likes to lie stretched out is of yang nature, while one who likes to curl up is yin. Hot limbs and body is ascribed to yang, cold limbs and body is to yin. Red face is yang, while pale face is yin. Persons who likes cold drinks is yang, and those who likes hot drinks are yin. Loud voice and talking a lot is yang, while weak voice and dislike talking is yin. Coarse breathing is yang, while a shallow, weak breathing is yin. Thirst is ascribed to yang, while no thirst is yin. A scanty, dark urination is yang, while a profuse, pale urination is yin. Constipation is yang, while loose stools is yin. A tongue with a red tongue with a yellow coating is yang, while a pale tongue is yin. A full pulse is yang, while an empty pulse is yin. Finally, following the discussion of the yin and yang character of symptoms and signs, it must be emphasized that although the distinction between yin and yang in clinical manifestation is fundamental, it is not detailed enough to be of much clinical use in practice. For example, if the face is too red, it indicates an excess of yang. However, this conclusion is too general to give any indication as to what the appropriate treatment should be, since the face could in fact be red from full heat or empty heat from yin deficiency, both of which can be classified as excess of yang. If it was red from full heat, one must further distinguish which organ is mostly involved. It could be red from liver fire, heart fire, lung heat, or stomach heat. The treatment would be different in each case. The theory of Yin and Yang, or the fundamental, is thus too general to give concrete guidelines as to the treatment needed. Thank you for listening.
Let's discuss the extraordinary young organs, the function of the uterus. The uterus regulates menstruation. The two most important organs for this function are the kidneys, because they are the blood, and the liver because it regulates blood in the uterus. The liver influences the uterus and menstruation in other ways too. Liver Qi moves during the premenstrual phase, which brings about the movement of blood and therefore the menstrual bleed. One can distinguish 4 phases in the menstrual cycle. Phase 1, the bleeding phase. During this phase, blood is moving. For bleeding to start at the right time and with the right amount, it is essential for liver Qi and liver blood to move smoothly and for heart Qi and heart blood to descend towards the uterus. Phase 2, post-menstrual phase. During this phase, blood and yin are relatively empty. That is not empty in absolute terms, but only in relation to other phases. And yin is beginning to grow. This represents the beginning of the follicular phase leading to ovulation. Phase 3, intermenstrual phase. During this phase, yin reaches its maximum with ovulation and therefore starts to decrease after that. On the other hand, yang starts to grow and this produces the heat necessary for ovulation. Phase 4, premenstrual phase. During this phase, yang grows and reaches its maximum and qi moves. So we have here the illustration. The phase 1, the bleeding phase. During this phase, blood is moving for bleeding to start at the right time and with the right amount. It is essential for the liver qi and liver blood to move smoothly and for the heart qi and the heart blood to descend towards the uterus. The phase 2, the postmenstrual phase. During this phase, blood and yin are relatively empty. That is not empty in absolute terms, but only in relation to other phases. And yin is beginning to grow. This represents the beginning of the follicular phase leading to ovulation. The phase 3, intermenstrual phase. During this phase, yin reaches its maximum to ovulation and therefore starts to decrease after that. On the other hand, yang starts to grow and this produces the heat necessary for ovulation. The phase 4, the premenstrual phase. During this phase, yang grows and reaches its maximum and qi moves. The uterus houses the fetus during pregnancy. To do this, the uterus needs the nourishment of kidney essence through the directing and penetrating vessels and that of blood through the penetrating vessels. During pregnancy, the uterus functions as a yin organ in that it stores the fetus. And during childbirth, it functions as a yang organ in that it discharges the baby. Thank you for your attention.
We continue with treatment principles, root, and manifestation. There is a saying in Chinese medicine, to treat a disease, find the root. This succinctly summarizes the importance of always tracing the clinical manifestations back to their root in order to treat a disease. This is because, generally speaking, the root is the primary aspect of the contradiction. That is, it is generally primary in relation to the clinical manifestations. As the root is primary, treatment of the clinical manifestations is usually carried out by treating the root. For example, if a patient complains of acute occipital headache, a slight temperature, a stiff neck, aversion to cold, a runny nose, sneezing, and a floating tight pulse, all these clinical manifestations obviously point to their root, which is invasion of the lungs' defensive qi portion by exterior wind cold. In this case, treatment is aimed at the root, that is, expelling cold, releasing the exterior and restoring the diffusing and descending of lung qi. When this is done, all the clinical manifestations will disappear. This is a simple example as to how the various clinical manifestations form a pattern, which, when properly identified using the tools of Chinese diagnosis and pattern identification, leads us to recognize the root and treat it accordingly. In this example, if the practitioner were not skilled in Chinese diagnosis and pattern identification and unable to identify the root, he might set about treating each of the clinical manifestations individually, which would, of course, be wrong. Another example, a patient suffers from a low-grade fever in the afternoon, night sweating, feeling of heat in the palms and soles, a dry mouth at night, and has a red tongue without coating. These are the clinical manifestations that, when properly interpreted, lead us to identify their root, that is, yin deficiency. To treat all the various clinical manifestations, it is sufficient to treat the root, that is, tonify yin. Another example, a patient has an unremitting high fever, irritability, thirst, rapid pulse, red tongue with yellow coating, and very cold limbs. In this case, there is a contradiction, as the patient has a high fever but cold limbs. However, taking all the clinical manifestations into account, we can identify interior heat as the root. The correct treatment is therefore to clear interior heat in spite of the cold limbs. These are due to interior heat obstructing the circulation of yang qi to the limbs, so that there can be the apparent paradox that the stronger the heat, the colder the limbs. Similar examples could be given of original patterns being the root and deriving patterns being the manifestation. For example, a deficiency of spleen qi, the root, may give rise to dampness, the manifestations. A deficiency of lungs, spleen, and kidneys, the root, may give rise to phlegm, the manifestation. A deficiency of kidney yang, the root, may produce empty cold, the manifestation. Qi stagnation, the root, may give rise to blood stasis, manifestation. Cold in the uterus may cause blood stasis. Common examples of original and deriving patterns as root and manifestation. So for the root, we are spleen qi deficiency with dampness as manifestation. Lung, spleen, and kidney deficiency will manifest as phlegm. Kidney yang deficiency, empty cold, qi stagnation, blood stasis. Cold in the uterus, blood stasis. Liver blood deficiency, liver wind. Generally speaking, the root is primary and is treated first. However, under certain circumstances, the manifestation can become primary and needs to be treated first, even though the ultimate aim is always to treat the root. The decision to treat the root or the manifestation depends on the severity and urgency of the clinical manifestations. There are three possible courses of action. 1, treat the root only. 2, treat both the root and the manifestation. 3, treat the manifestation first and the root later. Thank you for your attention.
Let's continue with diagnosis according to Zanko organ patterns. For today, we have lung, wind, water invasion. An invasion of wind water is an acute pattern. The difference between this pattern and an invasion of wind cold is that exogenous pathogenic qi has blocked the Wei Qi and the lung's ability to spread and transform fluids. This will be apparent in the edema and the disruption of urination. The urination will be scanty because the lung is not sending impure fluids down to the urinary bladder. It has its etiology in exposure to climatic influences such as wind, cold, and damp. The following are its signs and symptoms: facial edema, puffy eyes, scanty urination, aversion to wind, cold and dampness, breathlessness, cough, puffy and shiny face, greasy white tongue coating, and a superficial and slippery pulse. Its key symptoms are facial edema, aversion to cold, superficial and slippery pulse. For the treatment principle, we expel wind, damp and cold, activate the Wei Qi, open the water passages, and regulate lung Qi. For the acupuncture, we can choose from points lung 7, LI4, LI6, GB20, UB12, UB62, SI3, REN9, and spleen 9. We can use the draining technique in mid-link. For the explanations of the choice of points, lung 7 and LI4 regulate the descent and spreading function of the lung. They activate the Wei Qi and expel wind, damp, and cold. SI3 and UB62 expel exogenous pathogenic Qi from the Taiyang aspect. GB20 and UB12 expel wind and activate the Wei Qi. LI6 and REN9 regulate the water passages, and spleen 9 drains damp. Here's another relevant advice. When there are invasions of wind water, it is advisable to fast and consume spicy, hot, which both energetically and in temperature, hot beverages to induce a sweat. This could, for example, be a hot whiskey toddy with ginger or a ginger and garlic infusion. It will be particularly beneficial to use the skin of the ginger in these infusions when there is acute edema and urinary blockage due to an invasion of wind cold. Invasions of wind water can be caused by lung Qi deficiency, and in turn, it can result to phlegm, fluids in the lung, and damp in phlegm. Thank you for listening.
Let's continue with the diagnosis according to 8 principles, the chronic exterior imbalances. Chronic exterior imbalances are typically B syndromes. B syndromes arise from the simultaneous presence of 3 separate types of exogenous Qi in the channels and collaterals. There may also be disruptions of the channels themselves due to trauma or repetitive movements that strain the joints, such as computer arm and tennis elbow. This disorder, with the exception of physical traumas, will often have arisen gradually, but there may also be episodes of acute flare-ups. These flare-ups will often be due to climatic influences or physical strain. Etiology: invasion of exogenous dampness, heat, cold, and wind. Repeated stress on the joints. For the symptoms and signs, there is pain in the joints and or muscles. For the treatment principle, expel exogenous Qi, regulate Qi and blood in the channel. If there is Qi deficiency, tonify Qi. For the acupuncture points, choose from relevant channel points, local points, distal points, cross-channel points, and points to expel exogenous Qi. If there is exogenous wind, add UB12, do 14, do 16, and LI4. If there is exogenous cold, add LI4 and do 14. If there is exogenous dampness, add spleen 6, spleen 9, and LI4. If exogenous heat, add do 14, LI4, or LI11. If there is blood stagnation, add spleen 10 and UB17. Needle technique, we do draining. For the exterior imbalances, are to be the factorial imbalances that are not exterior. Interior imbalances include all the imbalances where there is a change in the functioning of the central organ and where the vital substances are affected. There may well be combined patterns in which there are imbalances in both the interior and exterior. An example of this would be a person who is kidney yang deficient, interior deficient cold, who is also invaded by a wind heat, exterior excess heat. Imbalances in the interior can arise in one of the three ways. The first, exogenous evil qi that has been located in the exterior penetrates downward into the interior. Second, exogenous evil qi can directly invade certain food organs. And interior imbalances can also arise due to other factors such as diet, emotion, and over-insertion, affecting the sangpo organs and or the vital substances. Invasion of exogenous evil qi will usually be acute, whereas most other interior imbalances will be chronic in nature. When an imbalance is in the interior, it will have affected one or more of the sangpo organ or the vital substances themselves. This means that the body's physiology will be affected, and this will be apparent in the signs and symptoms that are manifesting. When there is an interior imbalance, certain organs and vital substances will not be carrying out their function optimally. There will be observable changes in the functions such as urination, defecation, appetite, sleep, and so on. Because the imbalance will have lasted for longer than exterior imbalance, and because the body's physiology is affected, there will not only be changes in the pulse, but the tongue will also show signs of change. So we have here a table, the differences between the interior and exterior imbalances. In the interior, we have mainly chronic, while in the exterior, it is mainly acute. For the interior, may be due to 6 forms of climatic evil qi, the 7 emotions, and the diverse causes, while the exterior usually caused by 1 or more of the 6 forms of climatic evil qi. For the interior, the sangpo organs, blood, qi, jing, or jing will be disturbed, while the exterior, the channels, Wei Qi, skin, tendons, or muscles will be affected. For the interior, there is disruption of the body's internal physiology, while the exterior, the body's internal physiology is not disrupted. For the interior, there could be changes in the pulse and tongue, while in the exterior, generally, only changes in the pulse. For the interior, the pulse is generally not superficial, while the exterior, we can feel the superficial pulse. For the interior, usually there is no aversion to cold and wind, while in exterior, usually there is an aversion to wind and cold. For the etiology, if exogenous evil qi is not expelled from the exterior, it can penetrate into the interior. This will occur because the evil qi is very virulent, sen qi is weakened, or the person has been treated improperly, and evil qi has been dragged inward and downwards. Initially, evil qi penetrate into the interior will be an excess or a heat condition. The symptoms and signs will be powerful due to struggle between sen qi and evil qi. This corresponds to the Yang-Ming stage of the 6 stages or the qi level of the 4 levels. If the evil qi is not eradicated, if there are repeated invasion of exogenous evil qi, or if the body's sen qi is deficient, the evil qi can penetrate even deeper into the body and will develop into a deficient pattern. This will be similar to the Tai Yin, Xiao Yin, and Zhou Yin stages, and the Yin and blood levels. The patterns here can be hot or cold patterns. Exogenous evil qi can also directly invade into the interior. These invasions are almost exclusively into one of the 2 organs. This will typically be when cold or dampness invades the intestine, stomach, urinary bladder, or the uterus, or when damp heat invades the intestine or the urinary bladder. Direct invasion of the exogenous evil qi into the interior will manifest with acute symptoms which will be excess conditions. The internal organs and vital substances can be affected by the 7 emotions and the so-called diverse or miscellaneous causes, such as diet, overwork, lifestyle, and so on. These imbalances will be chronic, but there may still be acute symptoms. This is typically seen when there are combined deficient or excess patterns. An example of this could be liver yin deficiency with ascending liver yang. Here, the person will often suffer from acute migraine attacks, even though the underlying patterns are chronic. Symptoms and signs. There can often be a complex mixture of symptoms and signs resulting from several organ functions being affected, and there can also be a combination of deficient and excess patterns. Knowing that the imbalance is in the interior is not precise enough. It is necessary, however, whenever possible, to locate the imbalance in the interior and find out what its nature is. There will be significant differences in the symptoms and signs between the various interior imbalances, depending on which organ and substances are affected and whether the combination is deficient or excess and hot or cold. Thank you for your attention.
Let's discuss depression and the Shen, the Hun, and the Tzu. The relationship between the Shen of the heart and ethereal soul of the liver was discussed earlier in our lectures. In brief, the ethereal soul gives the mind inspiration, creativity, ideas, plans, life dreams, and aspirations. This psychic energy is the result of the coming and going of the ethereal soul, and it is the psychic manifestation of the free flow of liver qi, and in particular of the physiological ascending of liver qi. The mind needs to control the ethereal soul somewhat and to integrate the psychic material deriving from it. It is in the nature of the ethereal soul to come and go. That is, it is always searching and has ideas, inspiration, aims, etc. It will be remembered that the ethereal soul is the kui of our human nature, and it has its own independent existence. The mind needs to integrate the material deriving from the ethereal soul in the general psyche. The ethereal soul is the source of many ideas simultaneously. The mind can deal with only one at a time. Therefore, control and integration are the key words describing the function of the mind in relation to the ethereal soul. So here we can see the normal relationship between the ethereal soul and the mind. The Shen controls and integrates, while the Hun gives movement, ideas, inspiration, intuition, creativity. When the coming and going of the ethereal soul is deficient, there is a lack of inspiration, creativity, ideas, plans, life dreams, and aspirations. This is an important feature of mental depression. It is important to note that the psychic coming and going of the ethereal soul may be deficient, either because itself is deficient or because the mind is over-controlling it. The latter is common in individuals with strong, rigid beliefs, religious in a broad sense, which lead the mind to suppress the psychic ideas coming from the ethereal soul. This situation may also arise as a consequence of guilt. In severe depression, there is a disconnection between the mind and ethereal soul. The ethereal soul lacks its normal movement, and the person lacks creativity, ideas, imagination, and most of all, plans, projects, life, aims, and inspiration, so that depression results. In severe depression, again, there is a disconnection between the mind and ethereal soul. The Shi of the kidneys has several different meanings. For example, it can mean memory, reflecting the influence of the kidneys on the sea of marrow and the brain, and therefore memory. qi can also mean willpower, and it is in this context that it plays an important role in depression. Willpower as a translation of qi includes willpower itself, drive, determination, steadfastness, enthusiasm, and physical and mental power. Depression always involves a weakening of willpower intended in the broad sense described earlier. That is, including drive, determination, steadfastness, enthusiasm, and physical and mental power. These are all qualities that are missing in a depressed person. And for this reason, we must always tonify the kidneys in depression, even if there are no specific symptoms and signs of kidney deficiency. It is because the emotional lack of drive and willpower is seen in depression. Indeed, this is indeed a kidney deficiency symptom by itself. To tonify the willpower and the drive deriving from the kidneys, we should use bladder 23 and bladder 52. So to repeat, for someone who has depression in which almost always the willpower is impaired or affected, we use bladder 23 and bladder 52. Thank you for your attention.